PWI, which we consider to be a predominantly white institution, versus HBCU, which is historically Black college and universities. And those two systems are very different in terms of education and how they're taught, how students are taught, and who teaches them. So we kind of want to just kind of talk about, thank you, Ashley. We just want to kind of talk about, just the different experiences as to what you can expect, or just what we have experienced, whether it be going to school in or teaching in the two different institutions. So I've taught in both a PWI and an HBCU, and in terms of going to school, I've only went to school in a PWI. So.
Okay, and same with me. I've actually gone to school in a PWI and at a HBCU, two PWIs, one HBCU, and I've taught in both, and they are very different experiences.
So let's just start with the obvious. The obvious in terms of what the differences are is definitely the student body. In terms of your PWI, that's what we call it. That it's a predominantly white institution in terms of student body and typically faculty as well. And your your HBCUs, you're going to have usually more ethnic minorities. And this is not to say that you can't have either persuasion, shall I say, in either institution, but that's just kind of what it is. And of course, your faculty usually are ethnic minorities as well.
Definitely.
So,
And
go ahead.
what are some key differences that you've noticed in terms of PWI versus HBCU in terms of the caliber of student, just
So,
based on your experience?
so mind you, I've only taught at one HBCU, and I know all HBCUs are not like this at all, but ours typically had, because we've changed that. Ours had, um, unfortunately, a lot of students who are dealing with barriers that the students at the PWI didn't have to deal with. So barriers such as just they had a poor foundation when it came to their anatomy and physiology. Now, mind you, that can happen at any institution, but when you have more of them in one institution, it's magnified, shall I say. So at the HBCU, I've had more people who are not prepared for college in general. A lot of times they don't have the prerequisites. They have them done, but their high school education system was not that great. So they already came in with a deficit. So then when they grow to come to college, they still have deficiencies. And we are finding that we have to go back and kind of get them caught up, so to speak, comparatively. Not always, but that's one thing that I'm seeing that's different. When it comes to the PWI, a lot of times that they have students they're usually more competitive programs. Not always, not 100%, but more competitive programs that I have seen them in. And we have issues. The issues we have deal with just in the PWI. We're dealing, and if we as minorities are in the PWI, we are dealing more with a lot of race issues, microaggressions, gatekeeping, and things like that. Um, we don't have as much of that issue in the PWI. What about you? I mean, in the HBCU. Let me correct that. In the HBCU, we don't have as much of that.
What I've noticed is something that you refer to, you say it's levels to this. So it
Yes.
really, like you said, first disclaimer, it really depends on where you go.
Mm-hmm.
Um, in terms of the PWI, I went to a PWI for undergrad and another one for my doctorate degree. Both were really good schools, highly competitive schools. However, the PWIs I've taught at were not quite at that caliber. I think in their mind they may be at that caliber, but in reality they're not. The level of student isn't um, super, not someone that's may necessarily be super competitive. Maybe your 3.0 GPAs, maybe your 2.8s, your 3.2s, but the 4.0s, not here. Um, in terms of the HBCU, that particular HBCU, we had students with a lot of challenges.
Mm-hmm.
As you mentioned before, challenges, barriers, um, And typically, the students that go there couldn't get into any of the other more competitive programs because the area where the HBCU is, you have other highly competitive schools, University of Maryland, Johns Hopkins, to name a few. Some of your top tier, you got to know your stuff. If you just don't even fill out the application, if you know you're not there, just don't even waste your money.
Hey, Cookie, how are you doing? I'm listening.
But
Go ahead.
but the HBCU there was not quite at that caliber, and it was also underfunded. That's another thing I
Mm,
find with a lot of HBCUs. They
yep.
tend to be underfunded, and for a number of reasons that would take this live to somewhere we would just weren't gonna go. But so it was primarily grant funded, so 75% grant funded, so 25% student funded, and because it was poorly funded, it had a low amount of resources. So the staff was stretched. I mean, education, period, people were stretched in. Very few places you're going to find where education, you're not stretched in. But this place was extra thin. Like, it was thinner than water. So, one person may be wearing 12, 13 hats. So,
Mm-hmm.
which also kind of lowered the quality of the education because it's only so much one person can do. And again, a lot of the students had deficits and challenges. So, like you were saying with the A&P, they were not strong in their sciences, despite the padded GPAs we would get, because you get an A in A&P,
Yeah.
but, all your exams were open book or something along those lines where you didn't, where no one was truly holding you accountable for the knowledge that you should have obtained. So then they would come in, and it's just a mess from the outset. And I've seen some students of that caliber as well at PWIs. I just didn't see it in the same abundance, but it does exist. But from my experience, I didn't see it at the same abundance at the level of PWI where I've taught. Um, some of the PWIs where I went, we didn't have those type of students because again, that was a highly competitive program. But is definitely levels to it. And one thing I've learned from being a nurse for a number of years, also from learning different experiences from TikTok and other social media platforms, is that your view of the profession is just so different based on your location. So, even sometimes I'm talking to Doc and she's telling me something. I'm like, what? And then I tell her something. She's like, what planet are you on? I'm like, yeah, that's how it is here. And it's just so, I mean, we had the same commonality that, the profession as a whole is a complete circus. But what part of the circus show you in looks very different depending on your
Mm-hmm.
location. So I think that also speaks for the schools as well. But I think there are pros and cons to both. So that's, something we can also discuss.
Casanova says disparities need to be addressed first. I 1,000% agree with you. Disparities, and that's kind of the issue that we're kind of speaking on, is those disparities when it comes to their own issues. So, true story. I work at a school that is not, it's really considered to be a PWI, but this PWI has no requirements. So when they have no requirements, you're going to get a lot of the ethnic minority students and a lot of the ones who don't have it together. They're not even really ready to be in school because they're dealing with a lot of life situations. And so, like today, we had a student who we were just sitting there doing class, and she just started screaming, just screaming at the top of her lungs. And we're
Oh.
like, "What? What's wrong? What's wrong?" And she's having a breakdown, shall I say? She's having a melt. She's melting. So, and I'm like, this is not how you handle this. You have so much anxiety. This is not how you handle this. And so we're dealing with a lot of students who have psychosocial issues, life issues. We have people who have childcare. We have people who childcare issues. People who are pregnant in school. We talked about that yesterday. Pregnant and going to nursing school. But when I say pregnant, they don't have a support system. So they have that. They have uh, limited resources or none. And HBCUs typically have less resources than the PWIs do. So you already have people who are not getting the best quality education because they don't have, and not in all HBCUs, but um, they don't even have like the same, like, okay, we're at my one institution, they have mentors um on campus for our students. The other school, like, there's no mentor, there's no study person, there's no liaison. They have social workers on this other campus. We don't have social workers. We don't have any of that, who just handle student situations. So that's kind of how it is. Cookie Licious says A&P is hard, but I'm passing with a 90. That's wonderful. A&P
Good.
ain't no joke. So that's wonderful. Casanova
And
also
I'm
says, yes, we have
assuming
called
that
EMS. Go ahead.
also, I'm assuming that 90 is a real 90.
I hope that's a real 90,
A
because she said,
real
because
90.
if it's not a real 90, you're going to be lost in nursing school. Casanova says, yes, we have called EMS 3 times this quarter to my class. That's what I'm saying. People up here falling out in classes and having, mental health issues and anxiety and panic attacks and all kinds of issues. She said it's a real 90.
Okay.
It's a real 90, she says. Um, and we have to deal with all those things in addition to try to teach, you know, school. Imagine, that movie Lean on Me. You remember that movie Lean on Me?
Yes.
That's school that I teach at, where you got to go in like, what is this mess going on
What is
here?
it?
Yes, and I'm kind of like, okay, you want me to make scholars out of these? Like, no criteria. And this is not even an HBCU, but I'm simply saying there is a big difference between the have and have nots, even in education. So we want people to be nurses who want to be nurses, but they don't even have the foundation of what they need to be a good quality nurse. And you will find that at each institution. But like you were saying, it's magnified at the HBCU or some of these other lower quality programs because there's more of them there. Like you said, they do happen everywhere. But whereas you have 50 students at a PWI, and let's say 5 of them are having difficulty, them same 50 students at HBCU, probably 25 to 30 of them, maybe even more, is having
I was gonna
difficulty.
say, yeah, probably 40, 43.
Yeah, you
Well,
said 40,
that's based
45
on
out
my,
of 50.
yeah, maybe that's just my experience, but yeah,
That I was trying
it's
to,
it is
I was trying to pad
magnified.
it a little bit, but but yeah, so when you have 45 out of 50 students or 40 out of 50 students who have uh, deficiencies, and you're trying to put up
Yeah.
fires all the time, it's very hard. Very
And
hard.
see, also what I don't think that out people from the outside looking in don't understand, and I try to see it from students' perspective, but I don't think students see it from our perspective because one of those things where you don't know what you don't know.
Right.
And by that I mean nursing school is already hard, even for the best, I'm gonna say best, brightest, most competitive. It's challenging because you have to completely change the way you think, right? And in addition to, other things. So keeping that in mind, and to top it off, you already don't have the foundational knowledge that you need walking in the door. But they don't see that. They just see, oh, nursing school is hard, it's dumb, I'm not learning anything here. You're not learning anything because you didn't come with the tools you're supposed to have when you got here. So it's like you pouring into an empty cup and all the water just going to the floor. It's supposed to go into the cup, but as a matter of fact, it's not an empty cup. Ain't no cup. The cup
Mm.
is home in the cupboard. You ain't even bring the cup. There is no cup. So you just pouring water onto the floor and it's running everywhere. Like, so that's what it's like when you have a student, regardless of where it is, that is just completely um unprepared. Or it's like trying to learn calculus and you haven't mastered addition and subtraction.
Yeah.
That's what that's like, to try to paint a better picture. Or as I like to say, um, it's like someone trying to go from just learning how to drive to driving a tractor trailer. So it's like you might want to try to get the hang of a car first. So that is something else. And then someone here says, this is key, says becoming a CNA first help me. And that, that may help you to some extent, but the roles and the thinking of a nurse versus a CNA, GNA tech is very different. There may be some procedural things you may have seen, but in terms of a lot of the exams and things like that, is very, very different. But that's something that may help some people. But I just like to say that to say, if you are nursing, because I know a lot of nursing students follow us, try to look at the whole picture. And also, when you're in the midst of the frustration and the breaking down and someone's calling 911, whatever's going on, um, before it gets to that part, just try to think, was I fully prepared for this program? Like, really, like, take a good hard look at it, right?
Mm.
And try to understand the whole picture. And that will, I don't know if it necessarily lessen your frustration, but at the very least, you can understand the part that you play as well. Because it's always easy to point the finger, oh, it's the instructor, oh, it's the school. And sometimes maybe it is. But 99.999% of the time, problems that we have, we brought on ourselves to some degree. So take a minute, step back and look at and say, was I truly prepared? Did I really do all that I could do to get myself to a level that's needed for me to be successful in this program? And if you can truly answer that as yes, then keep, searching to see what the issue is. But most of the time, some self-reflection will also help you to understand where your weak spots may be.
Casanova says her program is an accelerated program, so that makes it even worse. And I find that a lot of students, when they sign up for these programs, don't realize the caliber of how nursing school is. And then, oh, accelerated, I can be done in a year and a half, as an example. But then they complain, y'all not teaching me nothing. I got to go home and read all this on my own. That's how the program works. You have to do a lot of the studying on your own. We can't fit in a class, a 3-hour class, a 6-hour lecture. So that means 3 hours of it, you're going to have to come ready for and already done. And then when we come to class and hit the highlights. And then we keep it moving because you are in an accelerated program. I don't think they factor that in either. They just said, oh, I could be done in a year and a half. I could be done in, in this amount of time. But I got to come to class, twice a week or two, probably about 4 days a week to come to class. And we in class all day long. What did y'all think nursing school was going to be about? And that's even for a regular program. People are not prepared at all. Somehow the TV and social media has glamorized nursing to be, oh, do you want to be a nurse? You could be a nurse in as little as insert how many months. When I'm kind of like, and then the next thing you know, the program's going to be, you can be a registered nurse. You can have a BSN in 9 months. Now, what program is that? I want that route because it's the quickest route. I want that. There's no 9-month program that's good. Now, we're not talking about the RN to BSN program. We're not talking about that. I'm talking about traditional programs. There's not a program
9 months, no.
In 9 months that's going to be any good.
And Dr. O made a good point. She says, I do think these schools, PWIs, want to recruit underrepresented students so they can brag they're diverse, but we don't offer support knowing these same students may need extra support. And these accelerated programs are a whole mess. And their high school experience wasn't as strong. Dr. O, you're preaching to the choir. Absolutely.
I love Dr. O. Thank you for that comment because
you
know what? I told you, didn't I tell you diversity, inclusion, and equity was a trend? I may not say that to you, but I said it to somebody.
Yeah,
did I say that? Diversity, equity, and inclusion is a trend. Everybody hops on these trends and say, look, we have recruited. We have this many. We're going to put that one minority in the commercial. I said it in the commercial, front and center, because we want to show that we are to attract more people. But at the same time, like she said, we don't have the resources to help them. Where's the mentors at? Where the study sessions at? What is who's going to help bring the gap between what they didn't get in high school or what they didn't get in the A&P class and get them up to the level as the other said students? She is 1,000% right. Thank you so much for that, Dr. O. I appreciate you. I love that.
They just looking to check a box. It's like they just want to check a box to say that they did it. Yeah. Regardless
that's not a real company. There are some companies who really do want diversion. They really do want diversion. But I mean diversity, not diversion. They do want diversity. But the problem is that too many of them it's a trend. It's truly a trend for most of these programs to say, yeah, we are inclusive. Look who we hired. We even hired one Black faculty member. One. Hold on. She says, Cookie says, I had or asked myself those questions and I came to you all and I changed my mindset. I came across you all and changed my mindset. Good, Cookie Licious. We appreciate you because the thing is, these programs are designed to, nursing school is no different than healthcare in the sense that it's designed to take your money. And no matter which program you go to, they're going to take your money. But like I told my students today, you are a reflection of who taught you. So all these, I'm not going to say the word, all these poor nurses, they are that way because of who taught them. You are a reflection of who taught you. That is no different than your upbringing. How your parents brought you up, how you were raised, you are a reflection of that, good, bad, or ugly. You are a reflection of that. So whoever took you, whoever raised you in nursing school, you are a reflection of that. And a lot of this is very bad that we're seeing put out right now. Now, I'm not saying it's intentional. I'm just saying it's bad that they put students out, that graduates out who don't even know where the thermometer go.
And someone here, Khalif, said that their program left mentoring up to the upperclassmen volunteers to kind of reach back and mentor another nursing student.
I like that idea, but the thing is, we need to make sure that it's something that every student has access to, not where we have 3 mentors and you got 45 students. You see what I'm saying? You want to make sure you have a plan for them. Peter says, did an accelerate BS to BSN 1 year long class, 5 days a week, homework all weekend. But see, that's a program that's a BS to BSN. So I'm talking about, what you think about that? He said he did an accelerated BS to BSN. So he already came in with credits already. Okay. 1 year long, classes 5 days a week. See, the thing is, you have to have the mental mindset for that, though. Everybody's not like that. Everybody can't survive in a program like that. They don't have the mental. They don't even have the mental fortitude to. They can't even come to class 2 days a week. They complain about that, let alone 5. And then you have homework. They complain about that. Today's students ain't cut for that. It's a rare breed of people who can take a class, take a program, and say, okay, you know what? For 1 year, can I handle this for 1 year? You looked at that program and said, for 1 year, I can do this, and I'm going to commit to 1 year to get this done. You said that. Today's students don't do that. They complaining about an accelerated program that they signed up for, mind you, that they got to go home and read, and some of they got to read to themselves.
Yeah, that sounds about right. You definitely, and you have to be prepared for that. So if going in, that's something that you're willing to do. And that's another thing I tell people that are considering nursing, that the schools understand what you're signing up for. I think what happens, and this is some of the stories that I've heard. Okay, someone has an idea, I want to be a nurse. I'm going to take these prerequisite classes and I'm just going to apply to these schools. No vetting. Some people don't even know if the school is accredited or not, or what that even means. How the program is actually ran. Maybe they just picked it because they know somebody that went there, or maybe they heard it on TikTok, not even really understanding what you're signing up for. So I would definitely do research, because you're going to spend a great deal of time, money, effort, early mornings, late nights. You want to know what you're signing up for, and they are all not the same. Not even close. I mean, I've seen people, before you go to a restaurant, you might look on your phone and look at the menu, but people don't even do that, and they sign up for a $50,000 program.
Right.
Like, did you look at the menu? I mean, you might be allergic to something over there. They didn't even look. So, Dr. O says that some of the student mentors, they have training. Just call me Wit. I was like that when I started my LPN program. I felt neglected by my teachers, and I'm sorry you felt that way. I'm not. Could you share more about how you felt neglected? And then too, I think expectations of students are different, because in nursing school, a lot of these programs, we're not going to hold your hand. So I'm not sure what your experience was when you say neglected. That's a wide spectrum of things that could have happened, but just in general, we're not going to hold your hand. At this point, you're an adult, you have to be an adult learner, and we facilitate your learning. And that's what I don't think students also understand. They say, well, so-and-so didn't teach me. Well, what exactly okay, how about this? What do you think they should have done differently? 9 times out of 10, I can't get a straight answer. I can't, other than give you the test. What should they have done that is reasonable and still hold you to the standard? A lot of times you can't get a straight answer. Now, and not saying that there aren't some trifling instructors, because there are some that maybe you email them and they never return, or maybe don't answer simple questions, something like that. No, that's egregious. But I'm talking about as a spectrum, we facilitate your learning. So, we'll try to do activities. Some people may do lectures, whatever that looks like. We hold office hours. I've even had students, my office hours are at a certain window, and they're like, well, can you, I'm not available at that time. Can you meet me Sunday at 3 p.m.? No, I'm not available.
Boundaries.
No, No, this is the time I have available, and I'm happy to sit with you. If no one else signs up, because I do mine in slots, you got to sign up. And if no one else signs up, I'm happy to meet with you during that time. But no, Sunday at 3 o'clock, I'm not available, and I'm not going to make myself available. So, but then that'll be the same student that complains and say, "Oh, doc, not available." No, I am available. I'm not available when you want me to be available. So
Mm-hmm.
understand that as well, and understand that at this level, the expectations for faculty and students are just different than maybe what you experienced in high school. I don't know if maybe
Mm-hmm.
your high school English teacher was just at your beck and call, but it don't work like that here. Um, just call me Wit. I understand that there's no hand holding, but the teachers made it seem like it was a problem. Like, what was a problem? Um, can you guys speak on West Coast University? What do you think about that? I don't know anything about
I
West
don't know.
Coast University, but if it's 100% online, generally I don't like those programs. Um, okay, she's saying it's a problem to go over tests, to go in depth on a concept and help get a better understanding. Now, to go over tests, sometimes test review just depends on where you work. I've had some places where the policy was we don't review the exams. So, for instance, you have questions 1 through 10, A, B, C, D, E. We cannot say the answer to number one was A, number two was B. They said because to protect the integrity of the exam.
Mm-hmm.
But if we see a trend, like for instance, cardiomyopathy, like someone got all those questions wrong, or um, whatever it is, asthma, we go over those concepts, but we cannot specifically go over the exams. That just depends on the policy there. And sometimes it might depend on your educator, because students also cheat. Yes,
Yes.
they do. I mean, I know some of y'all the best ever, but there are some students that cheat, and they cheat hard. So there's also a level of protecting the integrity of the exam while still helping students to understand concepts, and to go over concepts. And here's another thing. Students have to also understand how to ask good questions. Doc, how many times have you had a student come up to you and say, "Can you help me with this?" Just whatever it is, respiratory,
Yep.
whatever. And you say, "Okay, well, yeah, I can help you. What's your question? Can you review XYZ?" "Well, I reviewed it in class. What's your question?" So you
Mm-hmm.
have to ask good questions, because we're not mind readers. So, I can ask you some questions back, but if you're just telling me, "Well, I don't understand anything," well, then I'm going to tell you, you need to go back and read it, because I can't take my brain out and put it in your head. You have to come with something. Again, the empty cup. You have to put something in there for us to work with. What do you think about that, Doc?
Oh, I agree. I had I mean, I have that same scenario often where they ask for help. Let me go back to the office hours thing. So I do agree with you on boundaries in terms of like, no, I can't meet with you. However, there's some situations in which my office hours conflict with their class schedule because they're in class during my office hours, and I've had that. So for those students where I verified they're in class during my office hours, I have met with them outside of my office hours because they cannot come. We want them to go to class. So in
Mm-hmm.
that case, I do meet with them outside of my office hours, but otherwise, no. Just because you want to go home and you want to meet on a Sunday, like you said, there's nothing going on like that. But to your last point about them asking, I won't say inappropriate questions, they want you to spoon. Most of them want them to spoon feed you, and I refuse to do that. So when you come, so I'll say in that case, well, tell me what you know about respiratory. Tell me what you know, and I will fill in the gaps. That gives me an assessment. I can make an assessment by knowing that did you even read any of it? When you come back and say, well, I remember in class you said COPD, barrel check, all this, tripod position, but I didn't really exactly understand the mechanism of which you were talking about X, Y, and Z. Okay, now I got something to work with. You see what I'm saying? And that's kind of what I do. So for me, I'm asking the question: tell me what you know about the subject matter, and let me fill in the gaps, because that way I can truly assess: is it that you just wasn't paying attention? Was it that you just didn't grasp the concept? What is the situation behind that? So I think it just depends. Let me get caught up on a few comments. So Peter says, I was at a PWI, only black male, but we were supported. We were super supported. And that's great.
Good.
Peter, your PWI sounds kind of like mine. I actually went to a PWI and had a great nursing education. I can truly attribute what I know as a nurse to the nurse educators at the PWI. Did I deal with microaggressions and some racism? A little bit. I did a little bit, but the PWI truly did prepare me for nursing Now, not the politics of it, but they did prepare me to be an actual nurse. Mona Love says my accelerated program was the hardest thing I've ever had to do in all my life. I could imagine. Imagine us taking us regular classes and you up here taking that at an accelerated pace and then trying to keep up and take all these tests every week. And the accelerated programs that I've taught at, they have a quiz one week, a test the next week. Every single week, you typically have one or the other. You're testing every single week. So those programs are kind of hard. Casanova says, I teach patho and can see the gap. I'm sure you can, because I'm telling you, they don't know. She also says, as a faculty advisor for the NSNA, and started our school chapter to begin mentoring. Yeah, I think that she said to begin mentoring, which is good. We need more programs like that people are mentoring, so that we can help with the discrepancies and the gaps between what the students do know and don't know. And then when they do fall behind, have a remediation process or resolution to help them truly succeed in nursing school, because a lot of programs don't have that. She also says we can't review the exam, but we can discuss concepts. Now, let me tell you why I see both sides of that story about the test situation. I see both sides because the integrity of the test is integral. We need to keep the integrity of the test. But on the flip side of that, you could tell me that the concept that I missed was perfusion, but that don't mean nothing to me. I need to know what about perfusion that I missed. You see what I'm saying? I need to know that it was, was it the hypertension? What did I miss about that? So I find that students do better on the next test or even your final exam if you have a better understanding about what I got wrong in the first place. So I see it both ways in terms of people who say, no, we're not going to show this because of the integrity of the exam. And then also the ones who say, well, we're going to show the ones you got wrong because of, you can't grow and learn if you don't know what you messed up on. So that's just my thoughts on that. And then, Casanova says, the amount of students who sign up for office hours and then not show up. You know what? What we're not going to do
happens all the time.
Is
that's
why
all my hours are remote, because if I log in and you're not there, I ain't there either.
PWI is predominantly white institution. That's what that means. Trey asked that question.
We have a question from Mona Cole. This is my first time listening to you guys. Thank you and welcome. What kind of advice do you have for someone entering nursing school for the first time? Hey, Dot CRMP is here. And should a mentor be in the area or the state with us? I would say, well, based on your question, I'm assuming you're already there. I hope you vetted the school already to understand what you're getting yourself into. Let's start there. Make sure they're accredited. Check out the program to see how many classes typically would they are they going to assign to you based on their schedule. Also, I would ask, is there a part-time option? Some schools don't have a part-time option. I would always ask that, because it's so many. I can't even tell how many students I've seen fail in nursing school. And I'm sure pretty much everybody on here probably knows a little something about that. Some people don't need to do this full time. Some people need more time to digest the information. People got life going on. Definitely, look and see if it's a part-time option. Even if you start out full-time and that's your goal, just know that if all else fails, at least you have a plan B where you can say, okay, if this is way too overwhelming, let me go part-time. For me, I went part-time for my master's and my doctorate because I had a family and had other responsibilities. And I just refused to lose my mind the way I did in undergrad. It just immediately no, pick somebody else, because I was hanging on by a thread. So see if they're accredited, see what the schedule of classes are like, see if there's a part-time option or any kind of flex sort of option, whatever they call it. I would also ask about mentoring. I would see what kind of resources they have for students in terms of extra help. In addition to just office hours, do they have nurse tutors? Like where I went for undergrad, they had it wasn't quite 24 hours, but our simulation lab was open until 11 o'clock at night, and they would run simulations. They had nurses working shifts all hours of the night. We could run out different simulations all day and all night. I would see what kind of resources they have in terms of that. I would see what kind of clinical sites they're working with. Some schools don't have clinical sites. All they do is simulation. So there are some programs where you may have little to no human practice contact with. I would definitely ask that. Don't just assume. And just because somebody else went there, that don't mean that's going to be the same when you get there. So I would, those are definitely some key concepts. And let me see. Dot says she was traumatized by the PWI. Me too, honey. She also went part time, and yeah, they did run Sims after hours. It was a PWI, but they it was a really strong program. It was highly competitive. It was expensive, so they had all the resources. I mean, everything, tutors. I mean, just everything you could ask for there. But I would definitely vet it to see what kind of resources you had, because you'd be surprised at how many places will charge you 50, 60 plus K and be bare bones. Barely got ink for the printer, and you paying $50,000, and you can't even print out a piece of paper there. What you think,
That's
Doc?
um okay. What question was you answering?
What advice would you have for someone entering their school for the first time?
Okay, I'm gonna answer that. But if Dot MP is still over there, ask her what her traumas
Yeah.
were for the PWI, or not that she can't hear me. What are your what are your traumas? What were your trauma? I just can't see the response. What were your traumas at the PWI? Because I think that's a real conversation to be had as well. So while if she's still there, while she's putting that in there, I'm going to answer the question as well. So you talked about a lot of the external things that they need to be looking for. I'm going to go with the internal approach. Know your why. Why are you wanting to be a nurse in the first place? Because are you willing to sacrifice what you need to sacrifice in order to do what needs to be done? I had a student today who told me, well, I don't want to do X, Y, and Z. Well, then you don't want to be a nurse then. Because
Yeah.
it's not negotiable what you do in nursing school. Nursing school is not negotiable. So what the curriculum is what the curriculum is. And they said, well, I don't want to do this. Well, okay, then have a good day. Because I'm not going to sit there and argue with somebody who, if you don't want to do it, don't do it. Grades are 0. Just that simple. So go in with an open mind that I'm ready to learn. I may not like everything that I learn. Oh, this is too much material to read. Okay, but you talk about somebody's life. So why are you in a program in which you're going to take care of somebody's life if you don't want to do what it takes to take care of somebody's life? So that tells me you're here for the wrong reasons. Because if you tell me that if my mom or my dad or my sibling, my whoever was laying on that bed, that nurse taking care of my whoever better know what they're doing. So you're telling me that your patients are not worth that? So why are so know why you're coming to the program. Are you here because you really want to help people? Do you really know, what nursing is really about? Do you know some nurses? Have you shadowed some nurses? Are you getting your view of nursing in terms of on social media, TV shows? Because that's not a reality of what nursing is. Are you impressed with the glamorization of nursing and that's why you're here? That's not going to help you through the program. And some people get so caught up on taking a test. Like, okay, you take a test today, you take the big test, which is the NCLEX, but at the end of the day, you're not doing this for either one of those. You're doing this to take care of real patients one day. And um, people lose the insight of like, what am I here for? People's like, well, what's going to be on the test? What's going to be on the test? It doesn't matter. Learn the material. Because if you learn the material, you can master the test. You can take care of patients, and we want you to take care of patients. And I think some people lose sight into that as to what they're really here for. Know your why, and when you have those bad days, you will have to go back to your why. Why am I doing this again? Do I really want to do this? You have to go back to your why. What are you willing to sacrifice? Are you willing to sacrifice anything? Are you willing to sacrifice a weekend or studying or going out or taking that trip? Are you willing to do that? Are you willing to not pledge this during your people who do Greek, not pledge while you're in school because that's not a priority for you? Do it in graduate school, or grad level. So people just have their priorities wrong. So make sure your priorities are straight. You know your why. You're coming to class prepared to learn. Even if you don't like the material, I'm here to learn. I'm an open book. I'm a sponge. Let me soak it in. I had a review session today. 30 students were invited to come. Only 10 students came to the review
I thought you
session.
were
Now,
gonna say
these are the
less
same
than
students who are
that.
failing. These are the ones who are failing, mind you. But they only 10 came. That tells me who's vested and who's not. Now, some of them didn't come because they had to work. I will give them that. And they gave them notice just yesterday for today. I do understand that. But there were some people who could have come, like, I'm not coming to that class. Okay, you fell into class anyway. We don't think this will help you. So some people are not vested for the right reasons. Casanova says, be the nurse you would want to care for your loved ones. I say that all the time. I say, would you want you as a nurse? would you want you the way you performing right now? Do you want someone who done failed all their tests and don't care taking care of you? So then
Don't
don't
know
be that nurse.
pharmacology, don't know your A&P, but taking care of you. Um,
Mm-mm.
that says, related to your question about some of the differences, she said, "Ooh, the discrepancies with discipline,
Mm.
probation more so on minorities." She went on to say, evening program working students treated them like young day students. So usually, not always, usually your evening students tend to be a little older, a little more established. They were not relating to the population. Um, Nurse Kim says only about 20 came to the NCLEX review. Now they're mad because they didn't pass the comp predictor.
Did I
That's
just
why
say
I said
that?
early. Yeah, and you know what? Earlier I said do some self-reflection.
Yep.
The majority of the issues and problems we have in life, we had a role in it. Regardless of what anybody else did, you have to look at the part you played because most of the time you played a significant role in it, but people just tend to overlook that. um but Nurse Kim says, but calling me asking what I do to pass. Sometimes I don't even answer questions like that. Sometimes I don't. So I need a minute. I need a minute. um but going back to what Dot said in terms of the discrepancy with discipline, in my um undergraduate program, I saw that, as well as my doctoral program. I often tell the story how my doctorate program, they one of the requirements was, because it was hybrid, it was some classes were online, some classes were in person, and some parts were in person. But the online portion, it was a requirement, which I hated. You had to put a photo on your profile, and I didn't want to put my photo because I knew I was going to be one of few minorities there, and I felt like I would be treated differently. So I put my, I mean, I did it because they made a big deal about it, and that's just a whole nother story about nurses and micromanaging things that don't really matter. But anyway, so and then my very first class, I followed the grading rubric. This was like for a discussion or something, and I followed the grading rubric. I did it to the letter. And I noticed that I didn't get all my points. So when I asked the instructor, why didn't I get an A? I did everything to the letter. And he said, oh, well, A's are reserved for students that go above and beyond. No, bitch.
Right.
A's
According
are
to the rubric.
reserved for people who did what the hell they supposed to do. No, I did everything. Like, there was no feedback saying I did anything wrong.
Hmm.
But you just going to take like 12, 15 points. Oh, no, you're not. So, of course, you're going to be training command, blah, 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 blah. And nothing ever got resolved. So I'm like, well, how do you get an A in this class? Because you give me a rubric and I do exactly as it states on the rubric. But you're telling me even if I do that, I don't get an A. So then I'm confused about how this goes out of 100 points. I did everything that's supposed to calculate to 100 points. You didn't say what any parts were incorrect. I don't understand. So she basically was saying that you had to do more than what was on the rubric. Let me tell you, I never hated somebody so much in my entire life. It's a sound on TikTok that says, raise your hand if somebody is alive because you ain't want to go to prison. That be her. I was like, and then it was like, it was my first class, and it just, all the trauma from my previous two nursing programs just came rushing back to me like, here we go with the bullshit. If I did something wrong, tell me I did something wrong. But literally, there was no feedback telling me where anything was incorrect. It was just that you didn't do more than what was on the rubric. I'm like, is this legal? Like,
That would have been
how is
that
this
would have been a
happening?
grievance.
Oh,
That would have been a
it was a
grievance.
grievance. I talked to the dean. They didn't do anything. I'm telling you, trust me.
Mm.
Pissed, pissed. Hey, I'm telling you, she's alive because I didn't want to go to jail. I'm telling. Oh my God, to this day, I hope I never see her in life or death. Like, it was that bad. Never again. Never again.
Bullock says that's what I call racism.
Yeah, and I think that's what it was. I couldn't prove it, and I didn't know anyone else in my class to know if she was doing that to them. And that was kind of like one of the disadvantages of that particular class being online, because I couldn't really see how she was treating other people,
Mm-hmm.
because that's,
True.
so it's like it probably was, but I had no real proof of it. But also, when you're a minority, you always, sometimes we're very sensitive to that anyway. if it is or isn't intended as racism, sometimes we just tend to be very sensitive to it because we've been, um, between us and our loved ones, we've been discriminated against so much that even if it's not racism, maybe that person's just an asshole, whatever the case may be, you still feel like that because for so many years, that's what has been done. Um, Dot says grad school was the worst than undergrad at PWI. Yes. And she said it was blatant racism. Khalid says, I'm speechless. I've had to sit in program directors' offices for going off on some homophobic students, but I always see why. Woo!
Yana Pooh says,
Lord
I
have
always
mercy.
wanted to be a nurse. I care so much for people, but so nervous to fail.
I always tell
To fail
students,
school.
don't, nursing school is the time to fail. Nobody wants to hear it. It's not sexy. It's not the $1 trillion travel contract you was hoping to hear about. But that's the time to fail. When you don't want to be failing is when you actually have to take care of patients. Because that's when, you could have a sentinel event, you could have, patient harm done, and patient harm, and anytime the patient is at risk, your license is also at risk. So I always say, if, you learn from failure, in school is the time to fail, but nobody wants to hear that, but it's true.
So, Yana Pooh, I would say, do not let your fear of failure dictate what you do with your life. Because, truth be told, the success stories come from failure. People, I may not have failed a class. I have failed HESI 2, 3 times or 2 times. Don't let do not let your fear for failure stop you from whatever your dream happens to be. That
Mm-hmm.
should be like, okay, you know what? If I so you know what? That'd be the question that I would ask. I would find a program. I said, okay, you know what? What happens if you fail a class? Am I automatically kicked out the program or do I get another
Mm-hmm.
chance? And if they say you kicked out the program, that ain't the program for you. I
Yep.
always want to know what my backup plan happens to be. In case this don't happen, then do I get another chance? So I'm one of those where like, okay, I want to know worst case scenario, what's going to happen to me? Do I have to wait a year before the class comes back around again? Okay. Do you offer this class every semester? Okay. Just in case, what's your policy? How many times can I fail the class? I have no intentions of failing the class. However, I want a contingency plan so that I can come back if I choose to come back, or what my options are. So if you want to be a nurse, please, 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 and you're coming for the right reasons because you truly want to care for people, we need you. We need people like that.
Mm-hmm.
We need people who want to come to nursing for the right reason and not come to nursing because they think it's so prestigious. It's nothing prestigious. I mean, well, okay, it's a wonderful thing to be a nurse. Don't get me wrong, but the glitz and glamour is what you see on TV because they don't happen in real life. Beyond your scrubs, once they get washed out to death, the scrubs don't make a difference. These people wearing the fig scrubs, that don't make a difference. I
Mm-hmm.
mean, when you unlicensed, it won't matter what kind of scrubs you got on at that point in time because you done did something egregious. So I welcome you to come into the profession if you choose to. Bullock says, my daughter had an IEP due to a 504 medical in high school. I made her use the Office of Abilities. Oh, they call it Office of Abilities there. Okay. We call it the Disability Services, but I like how they worded that. Casanova said, I was told English is not your first language. You need to drop out. Oh, that's a tough one. That's a tough one. I don't think you should drop out, but I think if you are an ESL student, that you need to know up front. Because I literally had this week where a student came to me and said he needed more time to take his test because he had to mentally translate everything before he could answer the question. And that's when he went to disability services for that. That's not a disability. So he
Mm-hmm.
passed the proficiency test on written and spoken English. So that didn't help him. So we told him he's going to have to take more time to study. So that's hard too when it comes to the ESL students.
Eden here says, hi, ladies. I start my first RN position 10-3. Congratulations. Float pool residency program. Kind of scared, but eager. I think you'll do great. Come back and let us know how it goes. Float pool is good because you get to see a variety of things. You get to move around. Personally, I like those type of positions because by the time the BS start, I'm already gone. Dot says, I agree, it's trauma. It is. Khalid, I also had an incident with an instructor that was talking about kids with HIV and more ignorant comments. Ooh, where these people come from? What state you in? Dot says she failed. And everyone has failures.
Mhm.
It's just that's not what's glamorized on social media. But anybody who that has done anything of significance have had failures.
Has
It might
difficulty.
not be the same failures that you've had. Everyone walks a different path, but they've had failures. And the more success you've had, the more times you fail. I don't care who you are. It doesn't matter who you are, where you come from, what you look like. That's part of the success process. Success is not linear. It's like this. And it's late nights, it's early mornings, it's tears, it's sacrifice. Sacrifice. Can you hear me when I said sacrifice? I just want to make sure you can hear me. Sacrifice and determination and hard work. And success don't care about your excuses. It doesn't.
So don't.
You regroup and bounce back. I was trying to catch up on these comments. Um, Ty says my school made us wait a year to retake, so your graduation date be pushed back. So when you're looking at programs, that's part of the vetting. Just you're just in case. And even, I mean, you might have to wait an extra year. It's not the end of the world. For me, that wouldn't necessarily be a deal breaker, but maybe for someone else it is. Khalif said, nearly failed Mother Baby, but got exactly what I needed on that final retake to pass. Mother Baby wasn't for me either. Trust me, I understand. Um, Let me see. Eden says, try to get into a nursing program for years and could never meet the requirements. Enroll in another program and graduate with honors. Congratulations. And had many ESL students in my cohort. All of them made it to the end and passed NCLEX on the first try. Good for them. And again, sacrifice and determination. So,
Mhm. Skill
people
set.
have the ability. You just have to be willing to do what it takes. And what it takes for one person might not be what it takes for somebody else. So you can't compare your journey to somebody else's because you're not them.
I says, unfortunately, I think a lot of nurse influencers have made nursing seem like something it's not. Nursing student influencers are, I think she meant as well, are guilty of this glamorizing behavior. I agree. I agree.
Yeah,
It's nothing glamorous.
not at
Um,
all.
Casanova says accommodations for ESL students. So you all have accommodations for ESL students? We don't. We don't,
We
because
don't either.
they have to take the proficiency, the English proficiency. It's called a TOEFL. I can't pronounce what it's called, but anyway, they have to take that, and if they pass it, then they don't get. There's nothing because it's not a disability. So, you said you failed the class you teach now. Casanova says she failed the class that she teach now. I didn't fail the class that I teach, but I'm telling you, that's the class that almost took me at the program. I teach OB, and that is the class. That is the class that almost took me completely out the program was OB, but I teach it now. So she said, yes, they get extra time to read and I guess and then translate and stuff like that. Yeah, we don't give extra time for that. They have to take that proficiency test for English and they don't get extra time. We just tell them they have to stay. See, that's a good point though. The fact that her program does that, and for somebody who was an ESL student, um, that's the point. Like, so if you know you're an ESL student, and now that I've learned that um certain schools do provide accommodations. If I was an ESL student, that's something that's going to be on my list. Let me find someone that provides accommodations in case I have difficulty in this. I think that's good to know because I didn't know that they have programs with accommodations for ESL. Ours don't. Every school I've been to has not. So that's good to know that there's some that does.
I'm just
Bossy
wondering, the
lady,
one that has those accommodations, is that a PWI or HBCU?
uh, Casanova, do you teach at a PWI or HBCU? I don't think she teaches at HBCU because we've talked
Okay.
before, but I'm not sure. Boss lady says, I just got home from my OB clinicals. Loved it. Good, good,
See,
good. And then any what for patho? Nella, you said any, what do you mean? Any type? You said tape for patho, please. What restate that.
so Doc, let me ask you a question. So
Oh,
PWI versus HBCU, if someone's looking at a HBCU specifically, what are some tips you would give them?
for nursing school.
Mhm.
Um, the same thing we already talked about. Um, is it accredited? Look at the NCLEX pass rate for the past 5 years. Don't go by the past year. about 5 years. Do the research in terms of, what do they pride themselves on? Like, what is that school known for? Are they known? It doesn't have to be for nursing, but are they known for academics? Are they known for the band? That's telling too. If they're well known for their band, look at the graduation rate of the school in itself, not just nursing, but in the school of itself. So if they accept, and this is another thing, if the HBU accepts 90% of the applicants, that's telling too. That means there's no criteria to get in. If you accept almost everybody that applies, there's no criteria to really get in. There's no baseline for that. So I say you want a program that they vet their students too. That there's some kind of criteria to get in. You want a program that, again, NCLEX for the past 5 years. You want a program that's accredited. I would actually want to tour the facility. Not when I say facility, institution. I want to know what y'all's labs look like. Do they even offer tours? Why is that important? Because if you up here using old, outdated equipment, or you don't have a lot of stuff, that's going to show. Here lately, a lot of programs will actually give tours of their nursing department as part of their marketing and recruitment strategies. So
that's one thing. And keep in mind, HBCUs are often underfunded. So what she just said about touring the facility, that'll also clue you in a little bit to see however they are funded, is it adequate? And one thing I will say about the difference between HBCU and a PWI, that the thing that I liked about HBCU, I just felt at home. I didn't feel ostracized or isolated. It was still extremely stressful, and I hated every minute of it because that's just nursing school. But in terms of just, not feeling awkward or feeling, so outcast because there were other ethnic minorities there, that was great. Having that sense of school pride was great. But in my opinion, nurse school is just always extremely difficult, no matter where you go. So if you are an ethnic minority or a part of the BIPOC community and you're looking at HBCU, I think that's definitely one of the big perks. But I will also ask the question of, how is this school/program being funded? That is so important. If they're heavily grant funded, that means that if for some reason the grant money run out, somebody not getting paid. That's a problem. You go to a school and people not getting paid. Who coming to work? Who's teaching you? How are you getting equipment? How are you getting anything? That's important. So even though that's more of an administrative type thing, and I know most nursing students don't think about that, but that's very important because I've worked in places where some of the grant money was pulled, and the problems will trickle down to the students. So that's something that you might want to understand going into. Unfortunately, a lot of them are very underfunded for reasons that are beyond the scope of this live. Khalid says, thank you, ladies, for raising our standards and breaking down barriers. Have a good evening. Thank you for joining us.
Thank you.
Dad said she liked that about HBCU too. I absolutely love the school pride and just feeling at home. I love that part. The disorganization, no. But the other part of it, absolutely loved it. My HBCU had it all, and my professors were more like I like professors and mothers that taught love. Okay, so I guess brown skin girl saying you felt like at home. So that's good too. And I felt that way as well. And some of my professors from my graduate program at the HBCU, we're still in good standing to this day. Even though I know they were tough on me, I knew that it was, like you said, out of love and not out of spite. Like my doctorate degree, who miss, you can't earn a 100 no matter what you do. Yeah. Dot says, I also felt like a PWI prepared me for real life nursing. Facts on facts. Yes. I was able to better cope with the racism. I can't say I better cope with it, but it gave me an introduction because as someone who grew up in the inner city around other ethnic minorities, I didn't have very much exposure to other races until I got to college. And it was a complete culture shock. Completely knocked my socks clean off. And I mean, socks gone. And once I got into the workforce, I was like, oh my God, it's worse. It just seemed like it did give me an introduction into it. And then it just seemed like the shit show started when I got to actually started working. Like when they say the shit hit the fan, like the fan was on high and the shit just came at me. Like that's how it felt for me. Because not only was I was young, so I was 22, so I was just learning how to adult and dealing with a lot of overt racism. So there's that.
When
Brown
you all
sugar.
said felt at home, I have to say, I've never went to school at one, but I teach at one. And going to teach at a HBCU compared to a PWI, it's like night and day. I too feel at home at the HBCU because of the fact that, for one, guess what? Majority of the faculty looks like me.
Mm-hmm.
See, doctorally prepared, master prepared faculty who look like me is a beautiful thing. It truly is. When we had graduation in May and you saw all those chevrons on them robes and they look like me, we don't see that in PWI. You may see one or two of us, faculty wise. So that was a beautiful thing to see those chevrons, to see those caps and gowns, to see those robes, and then to see that sea of ethnic minority students graduating, and we had a part of that. That is a beautiful thing as well. And I think that people don't realize, you know, how good it is to feel and to see something like that when the Harriet Tubmans and Sojourner Truths and the people like that paved the way for us to even be here. Mary Mahoney, Scales paved the way when your girl Florence was trying to keep us out of here. So I think the HBCU has really taught me about the pride aspect of being with my own people. And then when I went back to the PWI side, I'm kind of like, oh my gosh, it's like I can feel the anxiety come back into me because of, oh, I'm the only Black faculty here.
Mm.
And that's different in itself to be the only Black faculty or one of few. And then they not understand, like, we just don't feel like we're at home. That, you know, I told the dean that the other day, like, you know, I don't feel at home here compared to the HBCU because of who works here. Nella says, tips for patho exam. I failed my first test. I studied, but most of the exam material was clinical based. So any tips for her on patho?
Well, the way I teach patho and the way it's really hard to say, without doing some sort of assessment. But I will say patho is a lot harder when you don't know your A and P. And you don't understand how the normal physiology of the body works. It's kind of hard to understand when you introduce some sort of patho to it, how it will now function. But without understanding your course, where you are, and all that, it's really hard to make an assessment. But um, definitely, you need to know how the body's supposed to work normally before you start talking about abnormals.
Hmm.
And Dad says the constant anxiety, it ain't healthy. You ain't kidding. And
Mm-mm.
as I've matured as a nurse, I've learned that if I'm somewhere and I'm feeling that level of discomfort, it's time to go.
Mm-hmm.
It's only so much of that I'm going to deal with, especially. And for me, what was really crazy to me about healthcare, and I started out in healthcare as a teenager. I became a nurse in my early 20s, but I've been in healthcare long before that. The thing I never understood, to me, the hardest part was never taking care of the patients. Yeah, you get a patient here and there that'll get on, the patients come and go. That's a revolving door. It's the staff. It's the staff that will drive you crazy. Because I'm like, the patients, they here today, they're gone tomorrow. Okay, whatever. But to know that we're all in this circus and everybody's having a hard time,
Primary juice.
and all you can think to do is give somebody else a hard time. But welcome to nursing.
No. RN Robbie says, I got a friend who just passed NCLEX, already has a correctional job travel offer. I told her not to do it, but she won't listen. Let her go ahead and do it. The best lessons we learn, life teaches us. So if she's not going to listen, and I mean, I don't know if they've been on been under a rock or what. I do not know what would possess any new nurse who doesn't even have a foundation. I do not know why people think nursing school provided you with all you needed to know. The stuff don't really start till you hit that floor. So you're going to do a travel offer correctional job. That tells you that if they accepted her who just passed her NCLEX,
I
that
know.
tells you that they don't value her and they don't value the patients. And the travel agencies don't either. They set her up to fail. And if she
And
wants to, go ahead and let her.
I'm almost I'm almost sure what somebody gonna say, oh well, I worked there before. It's a totally different role. But you'll see. You'll see. Come back and
Oh,
let us know how it worked out.
RN Robbie says, I know that they said Maxim Health. I know about that
Oh
because
yeah.
we have
And,
the
and and
agency.
they typically don't pay well either. I don't like them.
Yeah, we have the agency here where I stay at, and I'm kind of like, they will set you up to fail every single time.
Hmm. And will tell
They'll
you
learn.
anything. Yeah, I don't like
Right. So
Maxim.
Nadia says, I could never understand new grads doing travel. So much you don't know. And who I really blame is the agencies who hire them. And who I blame on top of that is the hospitals who hired the agencies who hired them. Because as a hospital, I want to know, okay, who are you? We want this kind of, we don't want no new grads. So is there any criteria in which the hospital has to say, okay, this is what we won't take this, we don't want this? I don't know how that works. But I don't know. I wonder about the hospital.
They bring in someone with a pulse.
What is bad
I
about
mean,
correctional nursing? I mean, correctional nursing, you're dealing with inmates. So a new grad knows nothing about patients. To let alone know how to take care of an inmate, to either know whether they are manipulating them to get them into the cell. What are they don't know anything. New nurses know nothing. And I can't emphasize that enough. So it's not what's bad about correctional nursing. It's for whoever it's for. It ain't for me. But it's for whoever it's for. But new grads don't know what to do in any situation. They don't even know. Okay, new grads can't even take care of well patients. Let's just say they coming in because I don't know, maybe they asthma flared up, okay, and they getting better. They can't even go in and navigate a head to toe assessment and do their interventions in a timely manner, let alone try to come in and do corrections to inmates who could be, I don't know, playing her or truly sick. She's just risking her license. I'm going to let her be. Let her be.
I
Let her
agree.
be. I'm telling you, the best lessons come. I'm done talking to these people. Like, they get on my nerves so bad about these new grads. I'm so done with that. Go head on out there. We done already told you. I always say these nursing streets will teach you very well. Come join us in these nursing streets. They're gonna teach you very and humble you so quick. And I hope you don't lose your.
Hmm.
I hope she don't lose her license as a result of that.
And
Cookie says they
another
look at
thing
money
too,
here all the time in class. We're not ready. Nope, you're not ready. You're not.
hey Cookie, and
I'm
and
still questioning
another
whether I'm
thing,
ready or not.
another thing that I think that they don't realize is I used to way back in the day. I did corrections. I
Train
had a
her.
contract, and most correctional facilities have very limited resources. You need to actually be a stronger nurse to work in places like that and effectively because you don't have the resources that you would have in, let's say, a decent hospital setting. So your assessment skills need to be point on. You need to understand how things present and understand your red flags when before the patient actually crashes to actually know what it looks like on the front end. And a new grad, unless maybe they were a paramedic before or had some kind of super strong skill set, which 9 times out of 10 they don't, are not going to be able to identify those things. And again, you don't have those types of resources to kind of finagle with. You may or may not have other strong nurses around. So that's kind of a setup, but hey, I'm not here to tell people what to do. You do what you want to do, but it's just some friendly advice.
And when they come crying because of X, Y, and Z done happen, you can't blame nothing but yourself. If you told your friend and they still want to do what they want to do, just go ahead and let experience happen to her. Trey says, I can see that my brother is in prison and complains about the health care in there. I'm sure. I'm sure. RN Robbie says, when I first took the floor, I had to tell some nurses off. Like, I might be new, but you're not gonna make, what was the rest of this? I guess you're still typing it. You're not gonna make something. I mean, if you tell them, I mean, I guess it's one thing to tell somebody off, but the thing is, you still don't know what you don't know. I'm not sure what your comment really was, but you don't know what you don't know. And that's another
Yeah.
thing. New grads, overall, don't want to listen. They come in thinking they know something. They come in thinking they know something. Like, you know absolutely nothing. You kind of trying to tell people what they're not gonna do,
You have to be coachable.
and they not. They
Yeah,
not.
you have to be coachable. Just because you have some letters behind your name is good as toilet paper if you don't actually know what you're doing. That's
Mm-hmm.
like saying, you know, oh, I'm a plumber, and then you come to my house to fix something that you can't fix. But you're a plumber, but you can't fix the pipe that's broke. No, because you have no experience. And in nursing school, in any, it don't matter what you go to school for. No school is going to teach you every single situation. You never finish.
Mm-hmm.
There's a set
You're
of
right.
criteria, and that's what they're going to go over. It doesn't matter if you're in school for a nurse, a plumber, electrician, or roofer. Pick anything. You're not going to learn everything in school because you would never. It's so many different scenarios. School is to get you a very basic foundation, try to get you to think a certain way, and then you go out into the real world. So the first time someone said, "Well, they ain't teach such a nursing school," I'm like, "You never graduate. You still be in there." If they taught every possible thing that a nurse could know, I'd still be in nursing school, and I graduated over 15 years ago. So you never finish. So keep that in mind too. The next time somebody say they didn't teach such and such, or it could just be you went to a crappy program.
True.
Assuming you went to a good program, assuming you went to a good program, you should have a solid foundation, but you're just not going to learn everything. That's where experience comes in.
All right. So you say, "Hey, Dr. P, ASN student here. Any tips on how to become a competent and confident nurse? Thank you." That's loaded. Confidence comes over time. Confidence tends to come with more experience. Competent, that's what you need to work on now. Competent means you need to know your stuff. To be competent, you have to know your why. Why am I doing this? What is the rationale? Don't get caught up in doing tasks. I know how to remove a Foley. I know how to put in a Foley. I can start an IV. Okay, we can teach a dog how to do tricks. That don't mean nothing. I need you to be competent in terms of knowing the disease process and how to take care of a patient with that disease process. That means you have to know your anatomy and physiology. You have to know your patho. So what's right? What happens to it when it goes wrong? And as a result of that, how do we care for that patient with that situation? I often tell
Mm-hmm.
people when it comes to my being an OB nurse, I can tell you about diabetes all day, but how do we deal with diabetes when they're hypoglycemic? How do I take care of them if they're hyperglycemic? How do I take care of them if they're gestational diabetic? So I have to know how to take care of all three patients because how I care for all three scenarios is different, even though the umbrella is diabetes. So competence comes from learning the material. Confidence comes from learning the material and experiences. So that's how you do it. It's going to take time, but the competence is what you can work on now. Quiet Riot says, "I do know something, ma'am. I got the top HESI score in my school." Well, that's good for you because I got that. She said, "Just kidding, though." Good. That's actually good if you did get the top HESI score. But even with that, HESI is just preparing you for the NCLEX. You see what I'm saying? So it's kind of like we still have to know what we have to know on the floor as well. Don't be afraid to ask questions. Okay, that's another good one. Yep, don't be afraid to ask questions. That's a great one. Um, Cookie says, "I've been in healthcare since 16. I'm in my 40s now, but I have other degrees under my belt." That's good. Oh, talking about her just doing med passes. That's trouble right there. Oh, let me tell you, R and Robbie, they lying to her. So I think
Mm-hmm.
R and Robbie is saying that the new grad that just passed, they told them that she would just be doing med passes. You ain't nobody paying you to travel just to pass some meds.
That sounds like a scam.
That's a red
Or
flag.
something. Yeah, somebody not telling you everything. I'm
That's a red
pretty
flag. And
sure
they're
of
gonna pay
it.
you to travel to pass meds. And you know what?
Yeah,
That's even worse if you think about it. Because who makes the number one med errors? New
you
grads.
guys, yeah.
They're the ones who make the number one med errors is new grads. So just to say you're gonna delegate them some past meds, that's a double red flag. Ain't nobody, ain't when do I get to go to a floor and just work to pass meds? That's a very, I mean, it can happen, but that's a very rare situation. And no, it ain't nobody traveling just to pass meds. That's a lie. So Cookie says, "Love learning new things." That's good. Trey asks, "What constitutes a good nursing program?" All the things we talked about. That
Yeah.
they're accredited. That they have a good NCLEX pass rate for the past 5+ years, not for the past year, 5+ years. That what else have we said? that the
They have
faculty is
resources.
good. Good. They have resources. Thank you. They have mentors, resources. They
It's
have
well
provisions
funded.
for disability. Well funded. They have good educators. All these educators are not quality, and you won't know that until you get there. That let them go in and interview these people. Go ask questions. Go to the school. Stop calling these people on the phone. Go to the school and see what it looks like.
Mm-hmm.
What does the equipment look like? Do they have state of the art equipment? Now, it may not be state of the art, like in terms of it was bought this year, but is it still them crank beds from back in the 70s?
Sorry, the crank beds. I ain't seen them in so long.
That's what I would do. I went to nursing school
Oh,
with the crank beds because when we got to the hospital, we didn't know how to. But when we got to the hospital when I was in nursing school, we didn't even know how to lift the beds up and down because we had the crank beds in nursing school.
oh my gosh, I
That's
ain't
how
seen them
bad.
in a
I mean, that's how old
while.
our stuff was. Do they? Do right now? Are you preparing your students for the new NCLEX? Do you know how many
Mm-hmm.
programs who are still not preparing students for the new NCLEX, which is going to be in April? There are schools who are still have admitted students who will be taking the new NCLEX who are not preparing their students for the NCLEX, the new one.
Some of the faculty not prepared,
They're
let
not.
alone the students.
They're not. So those are a few things that we recommend, and then of course getting to know the faculty. Keita says my teacher made me scared to ask questions because when I did, she used to be very condescending.
Hey, Randy. Oh
And
yeah.
and annoyed with my questions, but I wanted to know why. So I took it on my own hands and tried to learn, but there's still questions that I experienced. Nurse could answer. In that case, that's when I look at it this way: I didn't pay X amount of money for you to educate me, and that's what you about to do, respectfully, professionally. That's what you about to do. I'm not afraid to ask nobody no question because I'm paying for an education, and if we have issues with that, then I'm going to go to the director or dean or whatever happens to be because I need a quality education. But that's just me.
Mm-hmm.
Aaron Robbie says, is the new NCLEX going to be harder? Yes. Yes. It's been determined. When I say harder, 15% of the test is going to be new. And it's going to be the next gen questions are based off of case studies, unfolding case studies. They're going to have fill in the blank questions on there. They're going to have drop down boxes where you click, select, auto apply, things like that. But the thing is this, you have to know the material. So if they give you a chart with a sinus rhythm on it, as an example, the question may be how I'm going to take her, like, it's going to give you some criteria. And it may say, like, okay, based on this sinus rhythm, the nurse needs to do X, Y, and Z. Well, you have to interpret what the sinus rhythm is first and then answer the questions accordingly. So you have to know the material now. Randy says y'all don't love me anymore. Hey, Randy. I
That's
don't
the
be on here like that.
live king. I don't see your live that much anymore.
Yeah, they done
Mr.
took you off
Merce,
my FYP.
you know what? I don't see him on my FYP
I
that much.
don't
My
see much on
my
my.
FYP has changed. Now that I
You
think
got to
about
send
it.
us your stuff because I don't really see to get the algorithm back to bring you back around. Because honestly, I don't even see. I don't really see you on my on my Inklex on my FYP.
Mr. Merce KC says, any advice on mastering the endocrine system? I feel like it's one of the most challenging topics. Um, the way I learned the endocrine system was I learned that it operates on a feedback loop. So if you look at a diagram of the endocrine system and kind of see how the different hormones circulate throughout, that was how I learned it, and I always keep that image in my mind. But again, I don't know what class you're talking about. I don't know, your background or what some of your what your current knowledge base is, but that's the whenever I think about the endocrine system, first thing that comes to my mind is it's a feedback loop. So once you kind of start to understand that, it may help.
Keita says we did my class. She made it so hard for whoever went over her head. I graduated thankfully, but it was a long, hard year. And you know what? And those are the unfortunate situations where we do have again bad educators, um, who I guess have something to prove. I'm not really annoyed with questions. I'm not annoyed with questions at all, as long as you did the reading ahead of time. So when you
Yeah.
went and read the material, and I'm not saying you didn't do this, but what annoys me is when somebody asks me a question, and it may not be something about the reading, but they'll ask me a question like, "Where do I find the rubric for X, Y, and Z?" I told you all day one everything was in the syllabus.
Yeah.
Or day one, I told
Questions
y'all
like
everything was in
that.
the syllabus. So don't ask me no question until you read that syllabus first. I tell them that all the time, and they, where is this at? If you don't go to that syllabus first, now if you look and you can't find the answer, okay, cool. Let me go see what I need to do. But do not ask me no question without reading that syllabus first. Number one. Number two, did you read the material before you come ask me the question? Now, if you read the material and you still don't understand, that's cool. That's cool because I'm gonna explain it to you. But don't, like, nah, I ain't read nothing. Don't come ask me nothing. You got to do your part, then I'll do my part. And I'm not saying that was your situation. You said you would ask questions. I want my students to ask questions because that means they're engaged. So I want the questions, but as long as you did your part first. Don't come ask me nothing if you hadn't did your part. Aaron Robbie says, learned to take my NCLEX with making an invisible classroom, and here I was teaching. Okay. Okay. That's good. Trey says it's the test over the entire body and systems. The NCLEX is beyond that. That's anatomy and physiology that you're talking about in terms of the body and systems. It's about how to apply everything from what you're talking about to actual patient scenarios and what to do in this situation. That's what the NCLEX is. You're going to take the state boards on how to apply the entire body and systems, as you say, to actual scenarios, and what are you going to do as your priority statement based on those scenarios. That's the gist of
And
what they
Raise Ray 101 says, ask questions, but don't be trifling. So ask questions, but don't be trifling. So in other words, feel free to ask questions, but come with some sort of knowledge base. Don't just say, can you explain everything to me? No, because that's what I did in class already. So come with some specific questions.
Tell me what you know first, and I'll fill in the gaps. That's kind of what I do. Tell me what you know. And if there's true, if I see the student is trying, they truly don't understand, then we may go in depth. We may go a little bit more in depth. But I have to see that you're actually doing the work first. Don't come asking no instructor what's going to be on the test. That is the one question that I cannot stand. What's going to be on the test? Everything. Everything that I assigned you. Everything I assigned you. That's why I say everything that I assigned you is testable material. That's how I say it. So you need to learn it. Because this is a patient we're talking about, not a test. Any of these
Exactly.
scenarios
And
will be
you don't get to
patients.
pick. You don't get to pick your patients most of the time. So whoever you get is who you get, and you have to
Aaron Robbie says, look at your
understand how to
objective.
take care of them.
Well, yeah, the objectives, right. So if they go over the objectives in the chapter that I assigned, that's what's going to be on the test. That's exactly right. If you go look at those objectives and you can answer those objectives, a lot of times you'll be okay. But I don't give study guides anyway. But
Me either. Brown Skin Girl says this new NCLEX is going to count a lot of people out. They're gonna have to prepare for it, and they might have to take it more than once.
the
Um,
national scores will drop next year. The
mm,
national scores will drop. And that's what baffles me, that we as schools know those scores are going to drop. And even with that, you still not teaching, you're not getting them ready for the test. I'm like, I can't believe, that's what I understand about these programs. You're not getting them ready for the test, knowing that the scores are going to drop nationally.
mhm.
All right, we have about, say, 10 more minutes on here. Any last minute thoughts, questions? You said, oh no, so y'all don't read the chat. What's what we doing, Randy? What you
That's
talking
what we're
about?
doing. I don't know.
Randy, you having a good day? You said y'all don't read the chat. We read it. But we about to wrap this up. I gotta work tomorrow. I'm tired.
Any last thoughts on a HBCU versus a PWI?
Um, Aaron Robbie says, what's considered application-based questions on NCLEX, like disease process you never heard of? Application is, how am I going to take care of the patient with the said disease? How I'm going to apply. So instead of just knowing what COPD is, that's a knowledge question. What is COPD? That's knowledge. Now, when this patient's sitting at a tripod position, barrel chested, and whatever the signs and symptoms are, and whatever my treatment plan happens to be, whatever the interventions, what is my first priority when it comes to a patient in this scenario? That is application. As a nurse, what is my first priority when it comes to them? As a nurse, what is the next intervention I'm going to do? Am I going to call the doctor first? 9 times out of 10, I'm not calling the doctor first. I'm doing interventions first. As a nurse, we do interventions, then we call the physician. So they're checking to see what you know about how to care for this patient population. And so that's what you need to know in terms of, and it may be diseases you never heard of before. That's where critical thinking comes in at. If you can critically think, you can answer those questions. The problem is, well, this is the reason why they changed the new NCLEX, is because people can't critically think. We have seen a decline, a steadily decline since 2015 of new grads with the inability to critically think. So therefore, as a result, we have a new NCLEX coming out. And this one right here, even though it's only 15% of the test, the new test, it's gonna fail some people because you all don't know, they don't know how to critically think. And if programs are not teaching you, getting you familiarized with the test, the new format of the test, and you see that for the first time on the NCLEX, you are going to be thrown for a loop. I'm not going to say you're going to fail because it depends on how many you get, but you're going to be thrown for a loop.
Yep, sounds about right. And also, when these nurses were coming out and not critically thinking well, patients have poorer outcomes. When patients have poorer outcomes, hospitals lose money. Remember, this all comes back to money. This is a money game. You're in healthcare, but you're really in wealth care. So remember that too. So it's always going to come back to the dollar. And also you are dealing with people's lives. So the inability to critically think, you are direct and you have a role in directly impacting someone's health in their life. Just think about that for a minute. Would you want somebody to, and understanding some of the nurses that do some really in-depth interventions for patients, would you want that person working on you if you were critically ill, who can't critically think, or don't understand when, or aren't able to recognize when you first start having changes and maybe you're starting to take a turn for the worse, but they don't even realize it until you completely crash? It's things like that. And people kind of gloss over it, or they just think about the money, which, if you want money, I'm trying to tell you, this ain't it. But that's all they think about, but not think about ultimately that that's someone's life, and that could be you one day. Would you want your nurse or your physician or whoever that's taking care of you to not be fully competent? Just think about that for a minute.
The new nurses don't care. They just want the job. RN Robbie says my test made me cry. Talking about their NCLEX. You know what? I think I cried too when I took my NCLEX. I sat in that car after that 5-hour, 265 questions. I had to take the whole exam. I literally sat in that car and cried, but I
I
passed.
went day drinking. So I went day drinking. That's what I ain't thinking about this. It was an Applebee's up the street. I went day drinking.
You said Applebee.
I was broke. Shoot. I was a poor college student. I went and got me a drink. Brown Skin Girl 88 says, I have a question for both of you. How was your first year as an educator? I'm super nervous to change over. So you want to
go? Okay, when you say educator, are we talking about like clinicals or truly in the classroom teaching? It's two different environments, so I need to know which one we're talking about. In the classroom teaching, clinicals, because clinical is very different.
Well, I've precepted NP students too, but most of it is in the classroom. She said classroom, I do clinical now.
Okay, yeah. Classroom is a different beast than it is. I always tell people to do clinicals first to see if they try it before you buy it. That classroom, the what you have to know to be able to teach, and I'm telling you, there's poor educators out here because they just hire anybody because they need bodies. The first year was very rough because I graduated in 2020 from my doctoral degree, and in the fall of 2020, and we're talking about in the midst of COVID, right? So I had to come into nursing education, the teaching component on campus, in the middle of a pandemic. And you take that we go into online learning. We had to learn to do COVID testing on all our students before they come to campus. We had to do virtual for some people, virtual simulations, virtual clinical, I mean. It was a mess, but it was a mess for everyone. So add on the fact that everybody was going through a change, education, trying to learning how to write test questions, submit my questions to the testing, to our exam committee, uh, learning the dynamics of students and the caliber of students. That's how I learned, Dr. Ray, there's levels to this. I
Yeah.
learned that through coming to the classroom, because I'm thinking everybody who nursing school was like how I was in nursing school. And they clearly not. Clearly not. So my first year was rough and challenging, but it was due to mostly the pandemic. And then the fact that we don't have an orientation to education. A lot of times they're like, here's your classroom, or here's your class, here's your core shell, set this stuff up. I don't think students or non-faculty people, other nurses who are not into academia, understands what we go through in terms of putting classrooms or classes together. Dr. Ray know about, when classes start and I'm gone, she don't hear from me for a while. She must be busy. It's rough
Yeah, she
them
quiet.
first few weeks with classes, and I'm still trying to get acclimated to. And one school that teaches a quarter system, the other school that teaches a semester system, and they overlapping right now. That's very hard to do. So it was difficult. Your turn.
I would say for me, first of all, let me start by saying my primary role is as a nurse practitioner and as a clinician. I teach on the side. Let me start by saying that. Secondly, it was more of a culture shock than anything. And this could be a result of where I worked. It was such a culture shock for me when I did more of the didactic portion for undergrad. And that was another thing. I started out teaching grad students, NP students, which the mindset is a little bit different. It's still nursing school, it's still a bunch of cat fighting, but they are a little more mature, and because they've already gone through at minimum a BSN program, they already know how nursing school goes. They already understand the types of questions that are coming towards them. They already know it's going to be hard. So they already have an idea that this is like a nightmare. Versus pre-licensure, a lot of them are in shock that it's not like their A&P class where all the exams were open book, for example. So I painted that picture so you can understand my perspective. So I'm coming from doing grad school to pre-licensure, complete culture shock. I couldn't believe it. The students were not at the caliber that I thought they should have been. The institution itself was completely disorganized. I mean, I'd call it a circus. It's a complete circus. Um, and I just could not believe the lack of accountability that the school allowed the students
Mm.
to have, or lack thereof, should I say. A complete lack of accountability. The whole idea of pushing people through, even though they're incompetent, it was more of a culture shock to me than anything. And when I look at where I went for undergrad, I'm just like, what is this? It was complete night and day, complete total just culture shock. In terms of the actual students, I did enjoy interacting with them. However, they were so weak, and these were um, almost senior students. This was their next to their last semester, and they didn't know A&P. And I will never forget the student that told me that pneumonia was a disease of the liver. And I'm just looking at her like with my mouth hanging open. I'm like, what am I supposed to do with this? What am I supposed to do with this? And you're supposed to graduate next semester. What? How did we get here? So it's going to depend on where you work. The caliber of student um, that they accept is going to
Mm.
play a huge role um, in what you're going to do as an instructor, faculty, whatever whatever your title may be. But I would say that was my hardest thing, was just trying to understand the culture and how they did things, because it was just so different from anything I had ever seen before, and I didn't like it. I didn't. I found it to be stressful, unnecessarily stressful, and yeah, that was my experience. On the graduate level, again, it's slightly better because you have the students. I mean, sometimes you still have poor students, but they kind of expect it to be challenging. So it's not that part of where you're kind of trying to get them used to nursing school because they've been through it at least once already. But pre-licensure, it was a beast. So I take my hats off to Anybody that can do that. No. And what else would I say? I would say full-time faculty, depending on where you work, can be very demanding.
Mm-hmm.
And that's something to keep in mind too, is your workload. Because some people, I mean, I think it's just a thing with education. This whole thing about you supposed to work all this and do all this free stuff, it just don't click with me. But it might click with you. It don't register with me though. So definitely look at your workload and what the expectations are is different at different schools, and take that into consideration too. Some places want you to do research, publishing on top of teaching how many classes. If it's anywhere like where I work, you're gonna have overload because they're short on
Mm.
top of these other duties, on top of having weak students. So they're constantly, it's almost like you have to almost have to teach a part of A&P or some other or patho
Yes.
to even
Mhm.
get to the class that you're at, because I was teaching peds. So, but if you don't know how the heart normally works, if we start talking about tetralogy of Fallot, what's that? Because you don't know the normal blood flow of the heart. So understand all of that before you accept the position, I would say, because the more those deficits you have, the shorter they are staffed. It's just like regular nursing, the
Mm.
harder you're going to work. And I felt like with that type of position, that's just me. I feel like it's the kind of job you'll never off from. When I'm in clinic or I'm at a facility, once I see my patients and I bill, I'm done. I'm completely checked out. I will completely forget I have anything to do with healthcare. But being faculty, it seems like you really had to be good about boundaries, because it's one of those jobs where you're never done until the semester's over. Um, or at least on the didactic side, the clinical side maybe might be a little different. That's my experience.
That part is true, but that's the nature of academia. It's not done until, like, I don't take my stuff home with me. I don't. I will stay an extra hour at the office at my office to work before I'll bring anything home with me. So I have boundaries on that. But once the semester is over, it's over. Now, if you do a semester system, if y'all doing quarter systems where you only get off for a week and then you right back at it, that's rough. And I've taught in that one too. But I only work 8 months out the year, while y'all, even in the clinical side, working 12 months. So I work hard, but I get a whole 4 months off in the semester system to do absolutely nothing but still collect the check. So it's a trade-off either way it go. Do I work for it all year long, or do I do my work in my 8 months, get my work done, and get paid for the entire 12? Where in the clinical side, y'all working every day that y'all don't, you get paid, but you got to work to get paid. I don't have to work for those 4 months and I still get paid. So it's a trade-off. I work during the day. I work while I'm there, but again, I have boundaries. Well, these faculty members who bring their stuff home, and I will say, for the first couple of weeks of a school semester starting or a session starting, I put in extra hours. I probably work a good 60 hours a week for the first couple of weeks, but it settles itself out towards the end, where, as long as I'm teaching the same classes over and over again, it's not that hard to teach. I just kind of refine my classes, tweak them, and it's pretty easy. I will say that most institutions, at least the ones I've worked at, do not offer you any kind of orientation. Like I said, here's your job,
Mm-hmm.
here's your course. They ain't taught you how to set up your course shell, how to learn the learning management system, how to navigate the learning management system, whether it be Canvas, whether it be Moodle, whether it be eLearn or Blackboard or D2L. They don't teach you any of that. Sometimes you got to learn that on your own. That's hard, but it's a trade off. So you have to know, which one do you want to do? Do you want to, you know, um, at the end of my day, I'm done with what I have to do for till the next day. But at the same time, I get a lot of time off. So I like the benefit of working hard but getting off for 4 months out the year, where I get a check every month, but I literally sit in the house and do nothing, or go on vacation for the entire time if I wanted to. I don't. I still work, because I work a part-time job, just to have something to do. But it depends on what you like, and we don't work nights, we don't work holidays, we don't work weekends. And I love that. So it just depends what you want to do. Animal Fan says, have y'all been a part of a peer review? I have. Have you been a part of a peer review?
Peer review, no, not that I can recall.
All right, we're gonna wrap this up. You have any more questions on your side or comments on your side?
No, I've answered them. I've been answering in the chat too. Mr. Merce KC asked what experiences would be good to get in before going into nursing education. I said anything hospital based because that's pretty much, the training that they do.
Whatever your
Um,
specialty is, just, if you happen to want to teach a certain, and that's something else. Okay, this is something else. You will specialize in whatever you specialize in, and they may hire you for that. But as a registered nurse, you can teach all your basic classes. So as a registered, even though I'm an OB nurse, they can have me teach fundamentals in health assessment and pharmacology because every nurse should know that. Now, they shouldn't have me go teach mental health if that's not my specialty, but they will try it though. They say, "Can you teach mental health?" And I'm like, "No, I'm teaching research right now." And Lord knows that's the driest thing ever. I do not like research. But I'm teaching research right now. It's an experience. I had them do a paper on the Tuskegee experiment and how the IRB came to be, and they were like, "Oh, okay." It was a good paper, a good essay. I had them write an essay. But I'm learning how to teach, different things, different ways, asynchronous, synchronous, RN to BSN, LPN to RN, all these just kind of programs. You have to factor that in too because you're teaching at different levels. LPN to RN is a very hard student to teach because they come in with their LPN ways and you have to tell them to forget that and then relearn something else. And that's hard for them to do, understandably hard for them to do. So education is not easy. People think it is, but I'm telling you, the things that I go through, the nonsense kind of emails that I get. Matter of fact, right? True story. I told the students, I said, pick two black pioneers in nursing, and that way I'll pick which one you're going to do in case we have duplicates. How about they sent me Margaret Sanger? I said, she's not even black. Like, you didn't even follow the directions. Margaret Sanger's not even black. I said, find a black pioneer. And I'm kind of like, they're like, oh, I didn't know she had to be black. The title of the document says, find a black pioneer. You said, say that again. That the nonsense is, yes. Nurse Justin, how are you doing? Thank you for joining us tonight. I need him to be my mentor. That's who I need to be going to.
Ray,
That's,
Nurse
huh?
Justin, Nurse
Yeah,
Justin,
that needs to be my mentor. He be telling me
Ray's
stuff. He's smart.
Ray's Ray 101 said the huge lift is at the beginning when teaching a new course. It takes a lot of time. Yes, yes. It's like you gotta put in the work up front, but you get adjusted to that. For me, the shock was just everything else that goes on there. But again, that could be a reflection of just where I was working. It may not be like that in other places. And it also depends, if you're full time versus maybe you're adjunct. Because I know some people that are adjunct, but they adjunct so much they earn a full time salary. So
Right.
but see, they don't have to do all that other stuff. They don't have to do the research and the publishing and the advising and all those. I call it other duties. That's what I call it. So I don't like those other duties. That's just me. I didn't like it. Um, but you might like it. And then Monaco says, do you slash should you have an idea of what area of nursing you want to go into before going to school? No, no. I had no idea what kind of nurse I wanted to be, and I still don't. It's okay. We we just kind of figure it out as you go along. I still don't know. So
I knew what
no,
I wanted, but yeah, I knew
I
that
mean,
before. But if you don't, that's fine. But definitely use your clinical opportunities to kind of learn and see, is this something I would like to do? I tell people all the time, when you go to clinical, truly see what clinical is like. Do I like this? Would I like to be this kind of nurse? When I went to ICU, I'm like, you know what? I like having only two patients, but they so critical at the time. It was two at the time. They so critical. I'm like, no, I don't think I want that, type of thing. Use your clinical experiences to see if you like it.
and look past the glamour of it and look at the day to day what you really have to do. I worked in multiple specialties, and I don't even know if I have a specialty at this point. I just know the things that I'm not going to do. That's kind of where I am at this point. I just know that the areas I'm not working in psych. Don't ask. I don't care what they paying. Immediately no. I'm not working in the OR. Don't ask. Immediately no. I don't care how much they paying. I'm not doing OB. Immediately no. Don't ask. I don't care how much they
What's wrong with
paying.
OB?
I
Just
don't
playing.
like OB. It's too, ugh. I don't like OB, and I don't as and the ED as a nurse practitioner is okay. The ED as a RN, immediately no. I did a 15-week contract there. I could not get out of there fast enough. No. But that's just me. So I know what I'm not going to do. What I'm going to do, we'll see how I feel that day.
All right, y'all. We thank y'all for joining us tonight for this another edition of Nursing Dynamics and on live. We'll be back in a couple of weeks with another topic. If you haven't already, please subscribe to us on YouTube, as well as follow our page on here on TikTok, Nursing Dynamics,
Thank
which
you.
is one that Dr. Ray is actually on at the moment. And also, there's been people who have asked about our, what books do we vet for nursing, basically, in terms of study materials, things like that. If you go to the Nursing Dynamics link, you will see Linktree, you will see our Amazon storefront, which we have vetted those books that are there. So if you're interested in that, just go over there and find what you're looking for. Until the next time, I'm so tired because I got to work tomorrow. I'm so tired. Until the next time, we'll see you all in a couple of weeks.
Couple weeks. See y'all. Thank you. Bye.